Welcome. My name is Michael Lucido, and I'm a physical therapist, and I am a teacher and instructor with the North American Institute of Orthopedic Manual Therapy, also known as NAIOMT. Today I'm doing a series of videos that will primarily be used for our online education. And I'm using these videos, as I call these, the best of NAIOMT, the best of the North American Institute of Orthopedic Manual Therapy, giving you a taste of some of our different theory and practice that would then give you a sense of where we're going as an institute and whether you'd like to join us or not. Another technique that we use quite often for shoulder pain is to be able to elongate the serratus anterior. And it's a muscle that is a primary mover of the scapula. It's a muscle we don't actually think about being shortened, but if you think about many people's posture, with their forward head posture and their shoulder girdle coming forward into abduction and downward rotation, this would put the serratus anterior in a shortened position, limiting its function on the scapula. So one of the more effective techniques we teach in our shoulder courses is to actually stretch the serratus anterior. And this is a technique that, if you take a look at the origin and insertion of the serratus anterior and take them away from each other, you can very easily stretch the serratus anterior. The serratus anterior has two origin points. It attaches to the very superior part of the scapula. It also attaches to the inferior part of the scapula. And it's being held down to the thoracic cage by a suction force coming from the subscapularis muscle and other connective tissue. So in order to stretch it, we're going to place Luke's elbow like this. We're going to put our chest against his rib cage, and the serratus comes down and attaches to the lateral anterior aspect of the first 8 ribs. So we're going to put our chest against his chest. And then, firming up and supporting the spine, we can just take the shoulder girdle into retraction, leaning on his chest a lot, and then take him into retraction, and there he will feel stretch deep into the scapula of the serratus anterior. We can then have him push forward. Beautiful. Relax for me. I'm going to stretch him. Repositioning the scapula. He will need to be doing lots of re-education exercises after this, but this gives him a chance to address the adaptive shortening of the scapula. Push forward for me again and relax. And there's the stretch of the serratus anterior.